Hello and welcome to Natural Healing with Oriental Medicine. I'm Grant Boxleitner and I'm joined by Dr. Stephen Wrench of East West College of Natural Medicine. We'll be discussing auricular therapy and battlefield acupuncture. Right now, though, I'd like to send it out to the president of East West College, Russell Badiata.
Thank you, Grant. Ancient Portuguese sailors were known to wear a ring through their earlobe to improve their visual acuity while at sea. In ancient Rome, Greece, and Egypt, they all had early systems of treating the ear as a microsystem of the human body. The ear works like a remote control for the entire body as it is the most superficial representation of the central nervous system. Today, it is treated with needles, laser, ear seeds, and mild electrical stimulation. And the military uses it for what is known as battlefield acupuncture, for significantly lowering pain levels and treating post-traumatic stress disorder.
Thanks, Russell, and we'll be checking back with you later when we see a demonstration of this treatment. So, Dr. Wrench, this is something that I've never heard of. What is auricular acupuncture?
Well, Grant, auricular acupuncture is the treatment of the ear, or the auricle, as it were, by using the ancient medicine that we know to be acupuncture. So we might say that the ear is a microcosm, or a microsystem, a miniature, if you will, model of the entire body.
Of the whole body.
Every function, every organ, every extremity, every body part is found somewhere on the auricle.
The external part of the ear or the internal part?
No,
or
the
both?
external part. And if I may, just to give you and our viewers a glance, this is obviously a mock-up of a human ear, and you see all these little words and little diagrams on the ear.
Little red dots, is that where
these are all the points that we use, and some even on the back and so on. So this is literally a micro version of the whole body. So we can treat the ear much like a TV remote operates the entire mechanism.
Yeah.
This is kind of the remote control for the whole body.
How did this all come about?
Well, let's go back to ancient Egypt. About 2,200 years ago, there was an Egyptologist named Dr. Alexander Varil. He was a Frenchman. And he was interpreting hieroglyphics and writings in ancient tombs and things. And he found mention of procedures whereby they would cauterize the ear or make a small incision in the ear for different
so
medical
using
problems.
Like a hot needle?
Yeah, they would. And for one of the examples given was for a woman who decided she had enough children, didn't want to have any more kids, would have a little cauterization done to the posterior surface of the auricle. And it seemed to work very well.
So it almost says birth control?
In a manner of speaking. Also, ancient Mediterranean sailors would come into ports at a time when it hadn't been done heretofore, and they would have an earring in their earlobe. So people asked about what's with the jewelry at a time when not every country in the world did such a thing. They said, what's with the ring in your ear? And they would point to the ear and they would say, eye. And they would say, no, that's an ear. They would say, no, I mean, this is for the eye. So think about a sailor at sea, especially in those times.
Right.
We're out to sea, we're looking for, maybe they were whaling, they were looking for schools of fish, land masses or reefs that were just below the surface, man overboard, whatever it may be, but they needed visual acuity, need to be able to see great distances. So this was something that they picked up in China, and it made its way to the Mediterranean.
And this helped improve another sense.
Absolutely. But the earlobe actually represents the head. We'll talk later about Dr. Paul Nozier, but he was a guy who's considered today the modern father of auricular therapy.
Now, back then, that's kind of the history of it, and has it evolved slowly?
Oh, absolutely. And since I just mentioned him, I'll mention him once again. Dr. Paul Nozier was from Lyon, France. And he is today considered, as I just mentioned, the father of modern auriculotherapy, or acupuncture of the ear. He had a medical practice and was also a research scientist, but he had patients in his area where a lot of people had come from China and were living in this part of the village. He frequently saw these people as patients, and whenever he would examine give them their exams, and he'd look in their ear and their eyes, and every time he'd look in the ear, he would oftentimes see a little burn mark. So he asked, he goes, you know, the more I treat people from your village, the more I see this little mark. May I ask what that is? And they go, sciatic pain. And he goes, I'm not following. And they said, well, we burn it, hot needle, as you just said.
Right.
And so he goes, does it work? Oh, absolutely. He goes, well, who does this procedure? And it was a young lady that had been taught this in China and immigrated to this village. So he said, I have to understand more about this. So he had a meeting with her and he asked her about it. And she goes, oh, this has been around forever, thousands of years. So he began this research venture into the thing and became ultimately, and this will sound a little odd, he looked at the ear, and you know when you're a kid and they show you the moon, they say, look, there's a man in the moon, and you look and you go, yeah, okay, I kind of see it. He looked at the ear and saw an inverted fetus in the ear. This is the head, this is the spine, these are the feet. When you and I look at the ear, we don't necessarily see that, but I should have brought, and I could have, a diagram where they actually sketch it on the ear, and you can kind of see it.
You can sort of see this illusion.
But it exactly corresponds. The spine on the ear affects the human spine. The head, the eyes, the nose, the heart, the liver, it exactly affects these things. And that's the interesting part, and he gets credit for that, Dr. Paul Nozier.
And that's kind of the genesis of how this continues to be done today. So we talked a little bit, but this is a pretty broad question. So how does it work? Do you use both ears?
Well, you can, and depending whether or not we're treating it like an issue of an organ, let's say acid reflux or something, we would use both ears. If it's more of a musculoskeletal nature, like you have a tennis elbow, we use what we call an ipsilateral treatment. In other words, left tennis elbow, left ear. Right knee pain, right ear. And so it goes.
All right. And so is there a lot of the acupuncture needles involved in this, or it could be as little as one or two? I mean, I see in the diagram that you had, the demonstration model, that it could be literally dozens.
Usually it's not that many. What's nice about the ears, it has an almost immediate effect, whereas we have an acupuncture treatment, it may take a while. Maybe sometimes the patient gets off the table, and as they're getting off, we go, how do you feel now? And it's sometimes you feel, it's almost arrogant to ask, how do you feel now? And a person that doesn't understand acupuncture might go, oh yeah, like they're better all of a sudden. But 99% of the time, I'm telling you, people sit up and they go, oh no, I'm better. And so with the ear, it's even faster than that. So if we're going to get something, it'll usually be pretty quick. So what's nice about it is it's quick. You don't have to disrobe. You can sit in a chair and do it. You don't have to lie down and so on. So
you just kind of sit down. Now, does the ear have a lot of nerve endings that are pretty sensitive? Because I know people get their ears pierced, and it's a quick little.
Well, not so much more than anything else in the region. I will tell you, though, that brain impulses travel to and from the brain at 250 miles an hour. So while ear acupuncture isn't painful, and the reason is the needles are literally, as we've talked about and you've experienced firsthand, hair-like structures. And they're very short and very tiny, and we just give them one little tap.
You barely know they're going
so
in.
It's not painful at all. I would say, and I don't know, I don't have a pierced ear, but I've seen it done. And I can tell you that that looks a whole lot more dramatic than an ear acupuncture treatment. But back to your question about many needles and how many. Some treatments, 1, 2, 3, we'll talk later about battlefield, that's 5. So 5 or 10 needles, 10 needles is a lot in the ear. Yeah. That's a whole lot. So we're thinking usually more, it's in the neighborhood of 5 or 6 is a lot.
We will continue that. Don't go away. When we come back, more questions with Dr. Wrench, and then we'll go back to the college to see how this all works up close.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back to Natural Healing with Oriental Medicine. I'm joined by Dr. Wrench, and we've been talking about auricular therapy. I want to talk, we've talked a little bit about the history of this, but when it comes to the United States, how long has it been here?
Well, it goes back to about, it may have been here before, but when it started to be talked about, there was some research done at UCLA Medical Center in the late 60s, early 70s, where they literally tried to prove the efficacy of auricular acupuncture. And then in 1973 at Lincoln Hospital in New York City, Dr. Michael Smith got approval to use auricular therapy, acupuncture on the ear.
For many types of treatments or specifics?
Really for a specific treatment, and it was for the withdrawal from narcotics for addicts and so on. And there was a need for that. There were centers that offered various kinds of treatments, but they said, well, you know what? There's this new research, and why don't we try it? And he had some connections, pulled some strings, and they said, we've seen the reports, we've seen the results of these studies, and we're very impressed. We're going to let you do this. So he started what became NADA, N-A-D-A. It's an acronym for National Acupuncture Detoxification Association. And this is an organization that went around the country installing in these centers and where people go to quit smoking, quit drinking, drug withdrawal, and the like.
So even for potentially, like right now, we're dealing with this opioid epidemic.
Absolutely.
Is this being treated for those kinds of drugs too?
Yeah, it certainly can and is. And one thing to keep in mind, and when people ask about that, it's a lengthy protocol. It's not, this isn't magic.
Not just a couple of treatments.
No, it's generally done. A NADA protocol is done through, it may be done 5 times a week for the first week, in a tapering fashion, 4 for a couple of weeks, 3 for a few weeks, once a week for several weeks, and then maybe once a month as a maintenance. But you go into the clinic, you see people sitting around in chairs. They're sitting, it's a 5-needle protocol, put the needles in. In China, when they do this, they actually give the patient a mirror and they take out their own needles.
Oh,
now, we don't do that.
You guys still,
yeah, we're not
still
there yet, and won't be there. But so this is a wonderful thing, and it serves a great purpose. And that's when we first started to hear about acupuncture, as an auricular therapy.
And since the 60s and the 70s, it's certainly become more mainstream in clinics like yours.
Yeah, and I might mention also that many years ago I attended a seminar by Dr. Li Chen Huang from China, who is the #1 be-all, end-all auricular therapy specialist in the world. In fact, she was credited for years with keeping Castro alive by flying to Cuba. They had good relations with China, and she would go down and treat him using auricular therapy. It was at her seminar, and she was absolutely amazing. And the results, and she's written many books, but the results she got were phenomenal. She treats only the ear.
Let's go now out to the East West College of Natural Medicine and see a treatment using auricular therapy with Dr. Brandon Fuller.
Welcome back to our clinic theater. I'm here with Dr. Brandon Fuller with his patient Amanda, and they're going to demonstrate auricular acupuncture.
Thank you, Russ. So we'll be discussing auricular acupuncture. And as stated before, this was one of the earliest forms of acupuncture. Was brought up by sailors, right? And sailors would pierce their ear and they would say, hey, I can see a lot farther. I can see while I'm traveling out at seas. I can see land off in the distance, or hey, there's birds in the sky. I can tell what kinds of birds those are. So today what we'll be doing here is what's known as battlefield acupuncture. And battlefield acupuncture has been used quite often for pain management and psychological issues as our soldiers come back from the battlefield. And so what we'll do is we'll place 5 needles. Now each of these needles are specifically placed and will help us in whatever pain situation or whatever psychological situation is going on. Now it's important to know that it's not a cure per se, but it does help patients get through whatever issues they're having. So in conjunction with either psychological treatment or pain management treatments, or even even just rehabilitation treatments. This is an excellent, excellent treatment for that. Some other treatments that patients may know are things like NADA, right? And NADA was created back in the 70s in New York when there was a lot of problems with heroin. Heroin was a hugely addictive drug and was used so widely back then. And so what they said was, we're having trouble getting our patients off of heroin when using other forms of opiates. So they used auricular therapy to help calm the patient, to help deal with the psychological and the emotional effects of drug addiction. Now, this treatment that we're doing here for Amanda is slightly different, even though it's battlefield, but it still works on that same principle to help deal with whatever psychological or physical problem may be happening for patients. Patients tend to have, they tend to come to us and have trouble walking, or they have trouble dealing with their pain management. And battlefield acupuncture or the NADA protocol are the top two that we choose on a day-to-day basis. We say, okay, we're going to use NADA to help you because you want off of those pain medications and you've told your doctor, I'm getting off them, I can't take it anymore. Well, NADA will help you come off of those rather than just stopping pain medication and not being able to deal with the side effects or the withdrawal of opioids or other pain medications. Battlefield can be used to help deal with situations like amputations or broken bones or broken toes that even though they've set and they've started to heal, maybe they healed funny and now you're just in a lot of pain. Also, there's all other forms of ear or auricular therapy. It doesn't always just have to be needles. We also use things like seeds or tacks, right? With the seeds, we can actually peel them off and they come on a little bandage and you can place them directly on the point. We tell patients it's like a part of a take-home for them for their treatment to help with their therapy. They can press on these points and we ask them to do it 3 to 4 times a day. So they'll go home and they'll press directly onto specific points that we've asked them to press on, and it helps increase their treatment effectiveness, but also decrease the amount of times they need to come and see us. So it's a greatly effective tool to help us when treating patients, but also to help the patient in their management of their care. With other forms of acupuncture, we can also treat other types of diseases. So maybe there's hip problems, maybe there's back problems, maybe there's foot problems. The whole body is viewed on the ear. So we can overlap and know exactly what areas may be affected on a person. So we can press almost like foot reflexology. We press on one area there and we say, okay, you have back pain. But on the ear, we may be able to press on a specific area and say, okay, that's foot pain. We'll place a needle and then the pain will help, will start to reduce at that point. That's all I have for you today. So if you'd like to, come by and see us and we'll give you an acupuncture treatment. All right, thank you.
All right, fascinating. Dr. Wrench, of course, you've seen this before. It looked pretty straightforward.
Yeah, it is a very simple protocol. It's quite painless. It's not uncomfortable at all. In fact, most people are talking, and you put the needles in, and they're talking to someone else, and then they go, "When are you going to start?" And we go, "We're finished."
Already finished.
So the rest is them just sitting there or lying there, depending on how comfortable you want to be, and for a number of minutes. Then we just take them out. So.
All right, don't go away. We'll be right back with more.
Opioids are now a public health emergency in Florida. So what have you been prescribed for your pain? East West College of Natural Medicine understands the age-old Eastern philosophy of natural healing using acupuncture, herbs, and massage. Here, we combine Eastern and Western healing that results in a unified solution, individually tailored for you.
Massage is a powerful tool. It can alleviate pain, heal injury, and support well-being. East West College of Natural Medicine can prepare you for a career as a massage therapist. Our curriculum combines Western and Eastern massage therapy approaches, and the program includes an internship and job placement assistance. Launch a career you can feel good about. Start at ewcollege.edu. East West College of Natural Medicine, nurturing careers in the healing arts.
Welcome back. We're talking about auricular therapy. And Dr. Wrench, you had something that you were getting ready to show me. What is this?
This is a little packet of what we call ear seeds, and they're so small, I doubt our viewers can get a look at these.
Maybe able to zoom in a little bit. So these are just...
They're actually vicarious seeds. They're all exactly the same size, literally much tinier than the head of a pin, probably a fourth that size. And on the back side, we have a little sheet of adhesive. So it looks like a little tiny square Band-Aid. What we do is we take an ear probe, like I have here in my pocket. It's got a little blunt end, and we press on the ear in the region that we suspect is the area that needs to be treated. These will always be very tender points, especially if this point needs to be activated. So we'll press on that point with the probe, and we'll make a little indentation. Then we'll place a seed there.
So that'll fit right inside where you just probed?
It will. This will be temporary, but we press to see where the tender point on the ear is. And then when the patient goes, "Oh yeah, right there," that's where we put the seed. It tells us they're pretty much on target. Now the beauty of that is the patient is able to take that treatment home. So remember, the ears, it's a remote control. So while they're home, they're doing a little gentle kneading. They're rolling the little seed.
So this seed stays in before the needle even goes in?
Well, the seed is instead of a needle. So we may needle the ear a little bit in the clinic, but what we'll usually do is then seed the opposite ear, which has not been needled.
Okay.
So that when the patient goes home, let's say they have sciatic pain, and we place this little seed on the sciatic point in the ear, they go home, and when they're sitting there at night watching TV and they're thinking, "Yeah, my back's still bothering me," they massage this little seed. It stimulates the point, and it stays in there for about 3 days, and then you just peel it off like a little miniature Band-Aid.
So it stays on for 3 days, and how often are you supposed to
About
rest
once
it?
an hour for a couple 3 seconds. You just sit there. You want it to be a little tender, so you're kind of like punching. You're hitting the button again. You're punching that button, and so that's one method. We can also use electrical stimulation, which is something here. This little device here does two things. I'm going to ask you to hold on to that so it grounds you, and then I'm going to just touch it to a point in your ear, and what we're going to get is a little reading, and it may be picked up on our mics here, but I'm going to touch a little point.
Yeah, I hear that.
A little beep there. Now you're grounded, so
what
it
is
won't
that
activate
signifying?
on me. This is measuring electrodermal skin conductance. Now remember, we said that this is the part of the body where the central nervous system is absolutely the most superficial to the entire body. And if I didn't say that, I should have, but I think I did. But this is where we literally can read what part of the body we need to treat. And we already suspect it based on what you've told us. So we take our little electrodermal skin conductance mechanism and we touch and we get a reading, and that was actually a pretty good reading. That was actually called 0.0, and that point, if we were to treat it,
so I would be a good candidate for auricular therapy.
that would be the point we would choose, and I chose it for a reason. That's like a sedative when you needle this point, and that's one of the points that we use when we talk about battlefield a little later on.
Kind of relaxing for sure. Now, is there ever a time when it's not advisable to have auricular acupuncture?
Actually, the answer to that's pretty much no. It's never never inappropriate to treat an ear. And sometimes where you maybe couldn't access a certain part of the body, you can always access the ear. So it's painless, it's simple, it's quick. Again, you don't have to disrobe, but it's almost never inappropriate.
And it depends on like what pain or what treatment you're trying to address as to how many needles or even seeds that you would be putting in the ear?
Exactly. Whereas if we treated a patient with sciatica using acupuncture needles, we may in theory use half dozen, a dozen or more needles all over the body, but especially in the region where the pain's located. But for auricular therapy, we might just use one seed or one needle at the point that is per se the sciatic point. So that's the button, we push that button, and we're okay for a while with that.
So what are the benefits of auricular acupuncture over the whole body treatment, one versus the other?
Well, again, you can almost pop in on your lunch hour and have a quick, you know, it's quick.
Timing.
You could be in the door and out the door, Grant, in 5 minutes. It's possible if we knew you were coming and do a small treatment on your ear.
Now, once the needles are in, do you just rest there for five minutes, or it just depends?
With an auricular treatment, you could literally come in the door, we put them in, you walk right back out the door. If you're actually having acupuncture treatment and we're doing auricular therapy as an adjunctive to the treatment to intensify the treatment, as it were, then you're going to be on a table for maybe 30 minutes.
Right.
You're resting, you're comfortable.
Because the rest of the
lights.
body and like wrists and things, that takes a little longer.
Yeah.
I see. So are there other methods of treating the ear besides the needles? And I think that's what we talked about, the seed, but
we use the
other
needles.
things?
The needles are very short that we use in the ear. Generally, we can use a very much smaller needle. And the seeds. The other thing is this is actually called a Pointer Plus. You see the name on it there. And there's various versions, much smaller than this.
So this piece of equipment actually is a treatment. It doesn't prep treatment. This
No,
treats.
what I didn't do, and I wasn't going to without telling you, is if I'd have pushed this button, you would have gotten a little electric current into your ear. But I didn't want to surprise you with that, so I didn't do that. But we can dial that way down, and what we do is we touch the ear, and we're putting a little microcurrent to the point. So we can also stimulate it with a little mild electric microcurrent. And this is battery operated, doesn't plug into a wall socket or anything. So it's very, very
And you
minimal.
hold this to stay grounded.
Yeah,
And this
then
is just right in the chair.
Exactly. And the other thing, and we've talked about this and demonstrated before, the cold laser therapy can also be applied to specific points on the ear for a period of time, 5 minutes, 6 minutes, and that can also be used. So we find that, and Dr. Nogier found that by touching the ear and stimulating the ear, when he was actually toying with this idea on the ear, he found the pulses would change, and that led him to further research.
So Dr. Wrench, tell us briefly about battlefield acupuncture.
Well, the military took notice of this about 2008 and began using it on soldiers who were wounded in battle, and they would return them to Germany, and they had tremendous results using just little golden BBs, so to speak, that they use on the ear. And they would put these on the ear. They found that pain levels reduced as much as 75%, which was wonderful. Number one, here's a young person in a great deal of pain. Number two, it lessened the likelihood of addiction to narcotics after, and so on. So they were getting great pain reduction and great stress reduction. So it's pretty commonplace now in the military.
Great stuff. Dr. Wrench, where can people go to get more information about the college?
East West College of Natural Medicine, right here in Sarasota, in our 20th year. You can call us at 355-9080 and just ask for our clinic, and we'll be happy to talk to you.
And that does it. Thanks for joining us. We'll see you next time.